coverage in general will not change. I mean, if you have a plan and you like it, President Obama's promise was you get to keep it. This 3 million figure really is the, for some of the the smaller employers where they're in a small group market, but they're similar enough to they're similar enough to the individual market where their premiums are really high because of the small number of people, that it may make sense for them come 2014 when these exchanges are up and running to actually just either give their employees the amount that they were contributing and say, here, you can take that money and go buy your policy on the exchange. It won't cost you anything more because of what the plans on the exchange will cost, which again is still something that's not known what the rates will be yet. But that's
so. For example, small human service agencies that have 10 or 12 employees.
They're definitely in that category that might make financial sense for them to switch to the exchange. The large employers, it definitely makes sense for them to stay where they are. They've got a large enough group and they've got the negotiating power that they don't need to go onto the exchange. And then, the next slide kind of is just a nice, I always like pictures, it's easier than reading all the words. So the main thing is, the darker the color means the higher percentage of the current uninsured and individuals who will be gain coverage through either Medicaid or a plan on the exchange with subsidies. So you can see where some of the darker colors are, and ignore the white, that's where they don't have enough data to estimate. So the light yellow is really the one where it's 50% or below, and the darker colors are 65% of the uninsured in those states will need coverage.
Excuse me, can you stay there for a minute?
Sure.
The darker colors have higher proportions of uninsured?
No. It is of the uninsured in that state. So we'll take New York, for example. So New York is one of the dark colors. It means that the current uninsured in New York, the higher percentage of those people will gain coverage through health reform, compared to, say, Florida has a lighter color than New York. It doesn't say anything about the number of uninsured in those states. It just says of the uninsured, a higher percentage of them will gain coverage.
And why is that?
It could be because every state's Medicaid programs looks different. The eligibility levels are different, and some states have already expanded, so that.
And it looks like the light yellow ones are ones with a lot of immigrants.
Texas, California, yes. You've got Florida there.
Well, for instance, like New York expanded the eligibility for the S-chip program to like 400% or 300%. So that would be in that category because of current eligibility.
Because of current, New York, I should have picked New York. New York is a funny example. New York has a very generous Medicaid program, and so it already covers a lot of more people. I guess if you look at federal poverty level wise, it already covers higher income than a lot of the other states. And the reason New York is darker here is mostly due to the exchange. The people, so I guess I failed to mention earlier that Medicaid expansion goes up to 133% of federal poverty level. Exchange subsidies are available for people from 134 to 400% of federal poverty level. So part of the reason New York is darker is due to the exchange population. The other part is they also, there was a special deal in health reform where the newly eligible folks, the federal government kicks in 100% of the match in 2014. Even though New York has a lot of those people already, there was for several states who did early expansion were also able to get larger coverage. These numbers are included. And the next slide tells you a little bit about, so it says current action updated, so this is pre-health reform, what everything looks like. So the pie chart over there really tells you majority of Americans now get their coverage through their employers. Like we have a job and that's where we buy coverage. And if you remember that about 3 million individuals will lose their employer coverage and instead buy on the exchange. So that's the population that's going to cover, and it won't really change after health reform, the employer side. What the bar graph on the right tells you is a breakdown of that uninsured slice, the 15%. So the 15% of Americans in pre-health reform who are uninsured, this is what it looks like when you break them down by income levels. And it looks like, I have a chart, I have a slide later on that gets a little more into detail, but at least here it looks like that 65% of them will be eligible for Medicaid in saying that they make less than 133% of federal poverty level. And this doesn't break out the undocumented immigrants, which in the following slides will show a little bit more. And then about 37% will be eligible for 32% will be eligible for subsidies under the exchange. And so this is how that 15% breaks down. And I think I know you guys know it really well, but it doesn't hurt to explain to people who the remaining uninsured are, because I think you kind of lump this large number with the uninsured. It's well, who exactly are they? And I mentioned earlier that 8 million of them are undocumented immigrants. Then you have people who cycle on and off coverage. They could be unemployed or get a job and be able to have Medicaid, or then lose that job and become uninsured again. And then you have people who are exempt from the penalties. These are the folks that even with the subsidies, the premiums will be considered too expensive for them, so they don't need to buy. They're not part of the individual mandate essentially. Then there are people, for various other reasons, religious objections, and there are all these little detailed reasons in there. And then finally, the ones who decide, I'd rather take the penalty. I don't want to buy insurance. This is a lot of the current, the young municipals, right? And so the next slide is where I mentioned, if you remember earlier, the bar graph says 65% of the current pre-health reform uninsured will be Medicaid eligible. What this actually does, this is a study, a pretty recent study by Urban Institute, and they looked at the uninsured and how they're likely to get coverage, and only 36.5% will get Medicaid coverage. That's a pretty drastic reduction from that 65, and the reason is because of the undocumented immigrants. About 25% of the current uninsured are undocumented immigrants, and then the dark blue, light blue, green kind of tells you people with affordable, unsubsidized options, so they will buy policy on the exchange without any federal subsidies, and then the light blue is people who will buy coverage on an exchange with some sort of subsidies, and then the 16% are people who, even with the subsidies, it's too expensive for them, so that they're exempt from this requirement. And then, I don't know if there's any question just based on that.
Can you go back one slide again?
Sure.
So you said what was the total number of millions? It's 12 million that are going to stay uninsured?
23.
Oh, 23 million are going to stay uninsured.
Mm-hmm.
And so what you're saying.
23 by 2019, according to CBO estimates. This is Urban Institute's estimate of what 2014 will look like. So the first year of.
So in 2014, we will continue to have the ones that those will be the uninsured.
This is how the uninsured in 2014 will, I guess, break off into their respective coverage, non-coverage types.
Oh, okay. So undocumented immigrants are going to go nowhere.
Right, they're not going to go anywhere. So that 25% of the uninsured in 2014 will remain uninsured.
Got it.
So a little more details on Medicaid is Medicaid is the safety net program for a lot of the patients we take care of, a lot of the same people that you all work with. There is this, the major expansion happens in 2014. States have an option to expand early. This looks like a really good thing. Before all of the state budget crises and all of that discussion was going on in the news where, there's really no money for states to pony up to be able to do the early expansion. And the only two states that I know of are doing this, Connecticut and District of Columbia, is because they're currently funding this population with 100% state or local dollars. So taking this option actually gets them a savings of at least 50%, because the federal government's now kicking in part of the cost of covering this this group of people. If the state were to take advantage of this, they'd have to they would get their match, the normal match rate, not the stimulus enhanced match rate, and not the super enhanced coverage expansion match rate. And it all has to be budget neutral like any other waiver.
So which states do you think are going to do this?
Thus far only Connecticut and DC has done it. And I heard, let's see, Rhode Island, but don't quote me on that. That's pretty much it. I haven't heard any other. I've talked to our Washington, where they're thinking about this. You know, Washington doesn't currently cover this population with 100% of state dollars, and the reason they're thinking about it is, and they're not gonna do just a straight coverage, it would be some sort of delivery system transformation, like maybe it's a medical home model or a accountable care organization model. It's a way to, they can find non-state dollars to be able to finance a state portion, then they can at least pull some federal dollars to cover the under 133% of federal poverty level.
So you do this, but you put up the match, you don't get 100% money.
Correct. This is the normal match. So if your state, like.
And why would a state do that?
Well, the only two states currently are doing it is because they were paying for this with 100% of their dollars. So now at least they're getting the match. This is the pre-2014
Right.